Hello, my name is James, and my speech this evening is to inform my audience a little bit about ADHD and some of the characteristics that are associated with the disorder. Are you or were you ever one of those people sitting in a classroom or work environment, always fidgeting and feeling very distracted? These are a couple of the signs of ADHD. Other times that you just want to be left alone and you're feeling a bit antisocial or you're self-destructive, you may be suffering from ADHD. ADHD is the type of disease, so to speak, that can interfere with your social life. And with this illness, both children and adults can be affected. According to the CDC.gov, between 3 and 7% of school-age children suffer from ADHD, and this ADHD is a developmental disability, and ways that you can determine whether or not you or your child may have ADHD are things such as if you or your child is antisocial, self-destructive, hyperactive, aggressive behaviors can all help to distinguish whether or not you or someone you know may have ADHD. Hyperactivity and aggressive behavior are two of the main concerns that I have with my own. He's 6 and constantly getting in trouble at school, referral every day, principal calling, can't keep his hands to himself, can't sit still, and he's pinching, hitting, spanking. He's always got an excuse and he always says he's sorry, but yet he goes right back to doing it. It's almost like he doesn't even realize that, it's almost like he can't comprehend, what he got in trouble for, because he always goes back to doing the same thing. And not until recently did we put 2 and 2 together and realize that he may need to meet with a doctor to get evaluated for my and my fiance's concerns. The first step into getting into a doctor and have them look at the child's issue and have them look into the issue of possibly having ADHD is having the people that are close and involved with the child's life, such as the school and me and his mother, fill out it's an evaluation form. And some of the questions that are on that form is the child forgetful? Does the child have difficulty waiting their turn? And is the child angry or resentful? Do they have trouble keeping attention to what needs to be done? Paying attention pretty much. And this does help to determine based upon the child's symptoms. Also in the evaluation, you have to notate the overall school performance. Sorry, I can't speak. And then breaks down how the child does in each type of class they are in, whether it's reading, writing, math, and as well as their relationship with parents, siblings, and their peers, and how they do in organized activities. Information such as the above can be found on the American Academy of Pediatrics website, www.aap.org, and this website also provides detailed information about ADHD. According to the website, the physician who sees your child will evaluate many different activities to determine whether or not your child does have ADHD, such as looking into your child's age, because it's hard to determine in a child that is under the age of 6 years old, which ours just happens to be. So hopefully they can get that taken care of. And a doctor will also detect if the child's behavior is worse than other children in their own age group, and if the activity lasts more than 6 months, and the difficulty the child has in functioning in different environments such as school, home, and social settings. ADHD may not have one treatment, and you may have to go through trial and error in order to get the help that you do need. But if you feel like you or your child may have ADHD, it's best to get it looked into by a physician. Don't be scared or embarrassed. ADHD can really put a damper on one's life and the people in their life as well, and make it extremely difficult to function properly. Remember, it's not always the child's fault they can't sit still in school or church and focus on their studies. Also, it's not always an adult's fault that they aren't performing like others in the workplace. Doctors oftentimes, they've got to try many different approaches for each individual patient. Sometimes the treatment can be medications, Ritalin, Adderall, and they're used on a trial and error basis, basically, to get the dose right for the individual. And some counseling sessions could also be involved. And changes in environments which a person is struggling. Getting checked by a physician shouldn't be, like I said, embarrassing. It's something that needs to be done. And if you're suffering from any of these symptoms, this could be, just the visit you need to make, make your life better and the people around you a little bit better. And well, I do hope that you enjoyed my speech, and I thank you for listening.